Hey YouTube, it's Jay Narissa back with another video, and today we are talking about how public health is currently under attack. So we're only about 2.5 months in to the new presidential administration, and already federal cuts for agencies who are responsible for ensuring that the American people's health and well-being is optimized are being attacked and pretty much cut out altogether. Let's start with the most recent Department of Health and Human Services cuts. So, tens of thousands of employees at the Department of Health and Human Services have been laid off. And what that means for you is that a lot of the agencies that do research to ensure that new cutting edge strategies for better health and well-being for specific diseases or just prevention in general are likely not going to continue. The employees that are left are going to be overworked and underpaid, and it's going to be more difficult to disseminate the information necessary to ensure that everyone is aware of what's going on as far as health is concerned. There is currently an outbreak of the measles, which was declared eradicated around 2000 in the United States. And now all of a sudden, the cases are increasing. And what is done in return of that? Cuts. So instead of having the people to research why this is happening and figure out what can be done to stop it and ensure that it doesn't continue to spread, they're just going to make cuts to the workforce and make it more difficult to do the research. Does that make sense to you? Specifically within the CDC, they're talking about cutting the HIV division. Not only does the HIV division provide information about HIV rates and provide access for individuals who are living with HIV to the resources they need to be healthy and remain alive, because this is absolutely a life and death situation if someone who is living with HIV doesn't have access to everything they need to optimize their health and well-being. But also, HIV prevention work will be halted. So people who are in disadvantaged populations, they benefit from taking PrEP, or pre-exposure prophylaxis, which is medication that can be taken to prevent someone from contracting HIV. Those at-risk populations are Black men and women, transgender women, MSMs, or men who have sex with men. These marginalized groups are historically known to not have access to medical care, and so they have worse health outcomes than their white counterparts. And so if you're cutting funding that is allocated towards HIV research and providing that prevention and disseminating that information and giving disadvantaged populations access to the care that they need to prevent them from contracting HIV or to manage HIV once it's already been contracted, you are setting multiple populations up for failure. And why do you think that is okay? Let's talk social determinants of health. So one of the main indicators of whether someone will have a healthy life and whether a person is able to succeed in this life is education. Cutting the U.S. Department of Education is literal insanity when there are so many American idiots already. Like the US Department of Education ensures that people who need a little extra help in order to learn, students with individualized education plans, receive the help that they need so that they can optimize their education and in turn be successful in this life. Why would you not want that for them? Funding that goes to our educational institutions, Title I schools for disadvantaged populations. When you cut the US Department of Education, the less fortunate and disadvantaged are always going to be the ones largely impacted by that. And when I say disadvantaged in the context of low income schools, that doesn't only apply to minority races, that includes poor white people too. So to encourage such cuts when it negatively impacts so many people and circumstances is wild to me. Why doesn't anyone care about people other than themselves? It's really wild to me that so many people are in favor of the things that are happening as if it's not affecting them. And in some cases, maybe you're a white, cisgender, heterosexual male and you are a millionaire and it does not affect you. But for those people who are low income and they are uneducated, this is of no benefit to you. This is hurting you. Multiple agencies at the federal level have been cutting grant funding that supports research throughout this country. So professors and researchers alike who work for various universities, their funding is being cut and they're unable to research and add to the scientific realm of what's going on in the United States. And that means that we're not making advancements. We're not bettering the lives of people in this country. We're moving backwards. The decisions that are currently being made are not of benefit to the American people. I haven't seen a good thing happen in that presidential administration yet. When is America going to be made great? I'm not seeing it. So when you're struggling financially, your children are stupid, you're unable to get any assistance or help, there's no one to blame but yourself if you voted for this administration. In fact, those people have been really quiet as of late. Federal jobs have always been some of the most secure jobs within this country. And in the past couple months, it's like that has completely gone out the window. So not only is the research and the initiatives that were being worked on to improve people's health and well-being being cut, but the people whose jobs were cut are directly affected by that, and they're directly being negatively impacted because they can't even provide for themselves and their family anymore. Public health, a lot of people don't know what it is because when it's working and it's being optimized, there's little to be seen and done. People really weren't aware of what public health was until COVID happened. Then it's like, oh, where are the people to help with this public health issue? And now everyone's aware of what the field of public health is. But if funds keep getting cut and people keep losing their jobs, public health in this country is going to go down the drain, and everybody is going to be contracting diseases that could have been eradicated or could have been prevented before. People's overall quality of life is not going to be good. And this country, as we know it, will be washed away completely because of stupid decisions. And this really, really sucks. So, because I'm in this field, of course, I'm staying up to date on all the things that are happening. I may come back and talk about this again at some point in the near future. But let me know down below what your thoughts are. Are you surprised by anything that's happening in today's current political climate? Are you surprised about cuts that are being made? Is there any information that you didn't know before? Let me know down below. Like, comment, subscribe, turn on your post notifications, and until next time, stay healthy and stay well. Bye.